My name is Silvana Spatafora. I'm the Chief of Staff here at SAH Hospital, and I've been asked to summarize some of the things that have been going on for the last 3 weeks while we've been preparing as a group, as an organization, and as a physician group specifically to prepare for the pandemic when it arrives in Sault Ste. Marie within our hospital walls. We know we already have cases within the community. We are surmising that we have community spread. We have at-risk patients all over the community. And so recognizing this, we have been meeting almost daily as the Medical Advisory Council so that when the patients come through the door, we can provide the best care. As we've expected, we have been seeing an influx of patients with respiratory complaints. In response to that, we have changed the footprint of the emergency department. We've looked at the safest way to deploy those patients through the hospital so that this way we minimize risk to our community, we minimize risk to our staff, we minimize risk to our patients to get infections while they're here within the hospital. We've been looking at how we interact with the community. We have many physicians who are meeting regularly with their local partners, with their regional partners, as well as their provincial partners. We are literally updating and changing our policies almost on a daily basis as required, as requested by our Minister of Health and by our local public health.
As President and CEO of SAH Hospital, I appreciate the opportunity to address the community and provide you with an update in regards to the extensive work that has been underway in the hospital for many months, and more intensely, the recent work to respond to COVID-19. We are aware of the constant barrage of information and news in our daily lives, and we felt it was critically important for us to provide some reassurance to the community and heighten your awareness of the good work that has been underway at our hospital to help support our experienced healthcare workers and to help prepare the community for the changes that we are going to be implementing at SAH Hospital. And more importantly, we want to share with you how best to keep you and your family safe during these challenging times in our community and throughout the country. We are operating out of a central incident command through which daily decisions are prioritized, and we've been rolling them out for the last many weeks. And of course, our focus is on the safety of our patients, our visitors, and our staff. We have been planning to ensure that we have capacity to meet increasing demand, which began in collaboration with many of our fine partners, both in the community, including our home care teams, our long-term care partners, and our hospice partners. And through a lot of hard work throughout our community, we have created already at this time over 100 inpatient care spaces and are in immediate state of readiness should we anticipate or expect a surge in demand in the community starting today. This work is not over and is ongoing. As the lead for Algoma District, we are planning for our hospital surge together. So we're working in collaboration with our rural communities and partners and ensuring that we all have plans in place to support immediate expansion in our specific communities, but also be able to support each other should transfers be required between the various communities and alternative sites. Our local surge planning work is being undertaken in full partnership and collaboration with the city and the support of the mayor and the city council. Today you will learn more about the focused efforts to support the work of our emergency department for higher volume additional patients due to COVID-19 on site at SAH Hospital. Dr. Smith will share with you details around our revised triage process and what to expect if you come to the hospital. And he will explain to you what you will need to know and what to do differently should you end up at our emergency department.
The footprint of the SAH Hospital Emergency Department has expanded. We've done this to promote social distancing. You'll notice that the wait rooms are no longer crowded. We hope to continue this trend throughout the pandemic. The purpose of the tents in front of the hospital is to promote safety of our community, promote social distancing, promote staff safety, and facilitate safety of all of our patients. As a patient coming to the SAH Hospital Emergency Department, you will first be seen in tent number 1. In this tent, you will be greeted by one of the COVID screeners. They will determine if you are safe to enter into the emergency department or if you need to be seen in our second bay by an emergency medicine nurse. If you are seen by that nurse will help to direct you to the area of the department where you can best receive your care. In the future, should we start to see very high volumes of patients, we will be opening a second tent for patients who have upper respiratory tract illness, such as a fever, a cough, or shortness of breath. When you are seen in the second tent, you will be assessed by both a physician and a nurse. It is our hope that after an assessment at this tent, you will be able to safely return home to your families. All of our tents will be fully lit and heated at all times. The tents will be cleaned on a regular basis according to our infection prevention and control policies. The tents have also been reviewed by our health and safety team to ensure that they are a safe place for our staff to work. Our team here at the Surrey Hospital Emergency Department has done everything we can to make sure that your stay with us is as safe as possible. Please feel free to come and visit us should you feel that you have a medical condition that needs to be seen by a physician. We also would like to stress to you the importance of social distancing and hand washing during this difficult time.
This is a challenging time for our community and for our country. And on behalf of Surrey Hospital, we'd like to extend our thanks to your family, your friends, your neighbors, and you. We thank you for socially distancing and for doing your part to keep our healthcare workers safe and to keep our community safe. And we are also thankful to our incredible partners from across Algoma, our local community and leaders, Algoma Public Health, healthcare and other sector partners for your endless support and being there for us for all of our needs as they've arisen and being so responsive to help us at this time. We're incredibly thankful as well to our experienced healthcare workers who show up every day and are committed to providing the best care to you and have demonstrated their ability to adapt to this ever-changing landscape and changing conditions to keep you and the community safe. We are going to weather this challenging time by working together as a community, and although social distancing may be pushing us apart, it's also demonstrating the ability for this community to come ever closer and working together more than ever. So please stay focused on staying healthy. When you stay healthy, you help us and help the healthcare workers stay well to be there for you should that need arise. Thank you.